was a white girl with blonde hair. I changed meanwhile from a white woman to a black woman.
Oh my gosh. Mysterious facial patches, elven eye surgeries, and suspicious skin injections. Today we are breaking down and reacting to all of the flawed plastic surgery and wild medical scenes from Botched. All right, let's dive right in.
Hello.
Nice to see you again. Yeah, we met last year. I was a white girl with blonde hair. I changed meanwhile from a white woman to a black woman.
Oh my gosh, so she was a white woman and now has that dark of pigmentation?
This is real pigment. They injected this in you, yes?
Yeah, in the belly.
They gave you an injection.
In the belly.
One injection?
3.
So you've had 3 treatments. These drugs have been around for years. Melanotan into the body, it stimulates all the pigment-producing cells in your body, wherever they are.
This drug, it's a peptide. It's called melanotan 2, but it basically is a synthetic version of our melanocytes. So our melanocytes help with melanin, which is the coloring or pigmentation of our skin. And this is like touted as like the tanning med or drug. It is not legal or used in the United States. It's not for human use. The FDA here in the United States does not approve it.
They are warriors of love and light, and they protect the earth from evil aliens and stuff like that.
Oh, he's got the ears going. Spring those ears. Luis,
How
Dr.
are you?
Nance.
Nice to meet you.
How are you?
I love how the doc laughs. I mean, I would probably smile. You know, I walk into a room, definitely straight game face first. And then once you develop rapport with individuals, you know, do I have to be very sterile and clinical versus can we speak normal language? It just depends on the situation.
Hi, Luis. All right, Terry DeBro.
Nice to meet you.
Nice to meet you.
What is that,
Have a
crystal
seat.
ball?
This is a gift. It is a crystal ball. But if you move it this way, it can show you your dreams.
Show us our dreams. Ooh.
My dream is to become a fantasy character, and I will do anything to achieve that dream.
So very interesting first, when he was talking, he had no pigmentation to his eyes. They were all white. And now we see dark. So I anticipate that's related to like lens that he's putting over his eye versus like injections.
I have still to go to India to change my eye color again.
Again. Oh, so he has had change of eye color.
They do.
Laser color change.
So you've had 5 laser procedures on the iris of your eyes. Did you lose any sight with those laser eye color change procedures?
Well, I lose my sight, but just a few days.
They're changing the iris. The iris is the colored pigmentation of your eye. Having a laser procedure to change the colors of the eyes, the doctors are very concerned relating to his eyesight and the fact that he loses his eyesight for a couple days. Anybody out there would be like, well, what if it doesn't come back? And so then you think, okay, why is the eyesight being abnormal, especially that you're just changing the color of the iris? The issue ends up being, is there enough inflammation relating to the anterior part of your eye that you're not able to get any vision through to be able to transmit that information to your brain to be able to see. So that's the scary part, that there's probably that much inflammation that's going on causing issues.
When I was 9 years old, my grandfather was holding the dog. I was actually pretty terrified of the pit bull. All I remember is black.
Whoa. This is a quite common occurrence that we see in the emergency department. And so we see a lot of facial injuries, puncture wounds, lacerations. I've seen forearms removed, really serious stuff.
The doctors suggested that we wait until we see a plastic surgeon.
Crystal is very lucky that the emergency room physicians didn't try just to stitch up that big gash and opening in her cheek. Because the ER doctor does not have the same skill set as a plastic surgeon.
I will agree with that. When somebody does come to the emergency department and somebody has big injuries to the face, big defects, we give a call to the plastic surgeon. Our biggest thing from an emergency standpoint is make sure somebody's not bleeding out, make sure their pain is handled, make sure they're not getting bad infections.
We went to the doctor. He suggested the skin graft, take it from the groin.
So what happened with her?
They did the surgery, and then the hair started growing.
So you're getting pubic hair on your face.
Yes, literal pubic hair. I don't believe that the doctor mentioned I would grow pubic hair out of my badge.
Stop it. Oh my gosh. The reason why they would need a donor site is potentially that all the skin was gone. If the skin is actually gone and you don't have anything to close it up with, you don't want to just like squeeze it all back together, because then you'll start having pulling in different directions and you wouldn't have a good cosmetic repair.
When the scab fell off, that's when I realized there's a gap in between my eyebrows.
So he got a really bad injury, laceration to his head. A lot of hospitals and emergency departments don't have access to a plastic surgeon or a specialist. What you could potentially do is close the wound up and then have the patient follow up with a plastic surgeon in maybe the first 24 hours, and they're able to potentially adjust the repair immediately.
Your tissue is a little tight.
Yes.
To me, what I think is gonna be the safest way to go, just so that we have absolutely no tension anywhere, is to put something called the tissue expander in your forehead.
Oh my God.
It looks bigger?
Yeah,
It hurts.
Feels like I have a boob in both sides of my head.
What ends up happening is the tissue from a scarring standpoint gets really, really tight. And so that's what this doctor is mentioning. To try to repair it, there's not enough excess tissue and suggested tissue expanders. So these expanders go underneath the tissue and are like balloons, so to speak. They're basically slowly filled up to stretch out the skin.
Before my surgery with Dr. Nassif, I felt like the poster child of what happens to you when you don't wear a helmet. My left eyebrow was in 2 pieces and I felt really uncomfortable wherever I went.
So this is something that, you know, we really take into consideration. Obviously, you can have a big scar relating to injuries, right? If tissue is missing, so you have an option of like, do you just leave it open? You close what you got, do your best from a repair standpoint. But when it comes to the eyebrows, you really need to get as close to alignment as possible.
Let me see this.
This is the good one.
So you had the incisions made there. You healed those really well. Okay. But you're right. This one you can turn this way too.
No.
Oh.
Let me look. See? Let's see what the story is with this one. Oh, yeah.
It does.
Oh, it's flipping.
What? Is there bicep implants, I guess? Interesting.
It goes into your armpit.
I'm about to pass out.
Are you okay?
Yeah. It's like,
You know, it's really interesting that you can turn and manipulate this implant. So the implant is supposed to be benign, that our body doesn't reject. The fact that you can spin, move, and manipulate an implant, I don't think it's positioned in the right place.
You're only 2 body parts into this body modification thing, and you kind of have issues with all of it.
Besides the fact that they're, you know, moving under the skin, they're not obviously in the right place. What are the complications of it? Most of the complications that you see is body rejection. First, incision infections or infection of the implant or the tissue around it.
Those implants. They're gonna move around more. I wouldn't be surprised they didn't end up back on your triceps or down in your elbow, or they're certainly already in your armpits. They're movable, they're flipping. This one I could flip in 2 seconds. I could turn it upside down.
Could these different things form unique capsules and inflammation around the area? Yes. Could they move around and cause further damage elsewhere? Hey, they could. They can interfere with nerves, blood vessels. Just depends on which layer these implants were actually put in. They're talking about that it can actually go down into the joints, so then you wouldn't be able to move your arm appropriately. The plastic surgeon's concern is that they are not in the appropriate position and they will just become a nuisance and potentially cause worsening problems. Thus, the doctor wants them either removed or fixed. Oh my gosh, these are intense. All these surgeries on Botched can be intense. If you're looking to unwind from all this drama on the show, definitely check out my supplement, Do Not Disturb by Life Happens. This was pretty good. If you guys want to see me do more Botched episodes, let me know in the comments. And as always, do me a favor, binge watch this whole playlist right here, and make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.